Hello, everybody. There's been lots of changes happening in terms of the way that we do COVID testing, particularly in the NHS, and whether you're staff, patients, inpatients, and other settings. So in this session, we're going to cover exactly what all that means for you, your main information that you need to know, and basically what we need to do. Let's get cracking and take enhance your primary care and learning. Hi, everybody. So we're going to be talking about basically the different information you need to know about the changes in the testing guidance around COVID-19. And that comes into effect from tomorrow. Yes, April Fool's Day. Great day to make all the changes, isn't it? Anyway, hopefully this will give you the right information you need to know in order to make that effective decision for both yourself and your patients. We are going to be looking at the letter of guidance that's come out from NHS England that explains all this, so that hopefully you can reference back to that. And it's called the document C1621, Living with COVID Testing. And this is the first in a series of letters that are going to come out, apparently. We're going to talk about the different sections in particular. And we're going to kick off looking at community testing effectively, which is basically when patients come into general practice and that kind of stuff. So in terms of what that means, let's have a little look. Let's have a look at the document first of all. So let's bring it up just there for you. And as you can see, key information you need to know about community testing is basically it is changing significantly. For those patients that are immunocompromised and who are eligible for the monoclonal antibodies, that process still stays the same. So if they have symptoms, they still need to have a PCR test done in order to make sure that then they can have access to the medications they may need as a result of those letters they've already had. Remember, that is just for those patients that have those letters already and that are clinically at risk in the severely immunocompromised section of the categories and stuff. However, for patients, and this is the important part that many of you need to be aware of, all NHS patients in the community primary care setting are required a test by the clinician's advice. So if the GP, practice nurse, somebody says that your patient needs to have a COVID test, that is now going to be an LFD test rather than a PCR test. They should have a mechanism for being able to access that through the websites and stuff. However, that is the new route that is going to be moving forward. It is not going to be a PCR test from tomorrow onwards. Really important change there and stuff that's going to happen. So important for many people to know. And in the letter, it talks about all these changes in terms of the structure being, this is a change in the testing technology for this group of patients. Okay. So that is the main change when it comes to community testing. Okay. Next, we're going to talk about an important part, which is staff testing. So let's have a look at that. And as you can see, it's just underneath it. So from the 1st of April, in terms of staff testing, it will operate in the following. So NHS patient-facing staff will still have to continue testing twice a week, as you have been doing with the LFD tests. However, and that's when they're asymptomatic. However, LAMP testing, so that different route of testing for NHS staff, that's no longer going to be available from today onwards. After that point, you will need to access the LFD test as it says through the NHS portal, and that's hopefully going to be fixed so that allows that to happen. I know currently many people are saying that they're trying to request LFD tests and there's just none available. That might be because everybody's scrambling around for them, but hopefully that system will change in the near future. And that may change locally based on prevalence rates as well. There is that small line, as you can see just here, that identifies about the fact that it may change based on prevalence rates. For symptomatic patients, symptomatic members of staff in the NHS, another important change here is that they should test themselves using LFDs, not PCR tests. That's a really important change. So LFD tests will now continue to be available for staff, but that is the route that they will have to test for if they are symptomatic. Additionally, for those who do test positive, they need to continue the return to work process that was already in existence. So that's the whole concept, that you have to continue. So you have to stay off work for the first 5 days. If you are negative on day 6 and day 7 on an LFD test, then you are able to return to work, unless, of course, you test positive again afterwards. So important to recognize that. Next is staff who have a household contact. So if you have somebody in your household that is now tested positive, you no longer need to stay away from work as long as your asymptomatic testing remains negative. You also do not need a negative PCR test to go back to work. Again, that is a change, because previously it would have been that you would have to stay at home and have a negative PCR test before you go back to work and test. I think it was daily, if I remember rightly. Don't hold me to that. But now that is a change. So actually, if somebody else in your home has tested positive for COVID, you can still continue to go to work as long as you test still twice a week and remain asymptomatic. If you're taking part of any of the research studies and stuff, then you should follow their protocols if you continue to do so, and contact your coordinator if that's the case. And you can do COVID testing on an ad hoc basis if it's suggested by your employer for other reasons, if there's a reason for concern. But I suspect this is now going to be LFD testing, that PCR testing is not going to be available. It does not mention that in this particular document, but it does seem to be a trend moving away from PCR testing, especially in the community. So what about other different roles? So what about things like inpatient testing and that kind of stuff in hospitals? Well, you have to go back to the top of the document for that. So let's just do that right now. So here we are, patient testing itself. And in this part, it talks about different aspects in terms of inpatient healthcare settings. So for inpatient settings, actually, there's very little change, and much of it still focuses on PCR testing. So all NHS inpatients will need a PCR test if it affects the decision of their care, and that's to be determined by the clinical team looking after them if they're already an inpatient in hospital. Testing for asymptomatic patients on day 3 and day 5 to 7, that will be changing. That will be now moving to an LFD test rather than a PCR test as it previously and currently is. But from tomorrow, that will be changing. For severely immune compromised patients who move beds in a hospital setting, this will now be continue to use a PCR test. And as it says, there's no change in the current process for that. And all patients discharged to other care settings, including care homes, hospices and stuff, should continue to have a PCR test in that shift of environment and stuff. And again, that is not a change in the current process. Outbreak testing is going to change, however, though. Instead of it'll be looked at using the PCR testing originally, but that may change in terms of, sorry, there's no change in this one. Apologies, I'm getting confused with the next one. So there's no change in terms of outbreak testing using PCR tests, and that's to determine like a local infection control team. They are going to stop doing variant testing in a lot of the labs, and this will still be done centrally, but I'm assuming that information is not now going to be shared. But so therefore, in local labs and stuff in NHS, they're not going to be testing for the actual different types and things. So you won't know whether you've had Omicron or whatever comes after Omicron and all that kind of stuff and things. And it can still be determined locally if there needs to be for specific reasons like health and protection and that kind of thing. And then finally, we're going to be talking about basically when patients are admitted to hospital. So this is an interesting change that is going to happen. Okay. So all asymptomatic patients requiring emergency unplanned admissions via emergency departments, etc. and stuff should be offered a PCR test to make sure that they get the right placement and stuff. This could be a rapid test like they currently do in some hospitals. The 30-minute rapid PCR test is held, but they can continue to also use LFD tests in emergency departments if they need an answer there and then. So basically no changes in current process in that situation. Women admitted to labour ward settings and stuff should be tested as soon as arrival with a PCR test, but the birth partners do not need to be tested, so there's no change in that policy. Asymptomatic patients requiring an urgent emergency admission to mental health units, they should still continue to have their testing done as LFDs, and they can order their trust, the LFD testing through the trust and stuff. So there's no change in the type of testing for that, but in terms of how they access that, that's now going to be through the UK HSA portal instead. So important to be aware of that. And then planned elective admissions. This is the key one to be aware of. It should be using testing LFD in advance of admission. Patients need to be directed to the government website in order to order the test, and they'll have to confirm that they are having this procedure, and also potentially some additional information in terms of what type of procedure they're having, and then inform the trust if they are tested positive at that point. So this is going to be a change in the way that they're using the type of technology, because I believe before it was PCR testing that they had to do and had to isolate for a period of time before they could have their procedure. So this is now changing that route in terms of how that's working and stuff. So effectively, that's the different types of testing mechanisms that's now going to be available. Hopefully that's useful information for yourself. Key things to go back and have a look at is the primary care and also the elements of testing in terms of when it comes to staff testing in particular, because there are changes that are happening in that respect. So really important that you have a look at that. Useful to share this information with your other members and colleagues of staff, because that's the current information that we have. Kicks off tomorrow, so important so you're aware of it from moving forward, and especially for many clinicians out there, that information about their changing guidance about no longer requiring a PCR test for patients that are symptomatic, because that's the eligible part, is now moving towards being an LFD test instead, according to that guidance provided by NHS England. So definitely have a look and read of that. If you want the links to that letter, that's going to be down below in the show notes and stuff. And as always, we're here to help protect and enhance your primary care and learning, and catch you in the next episode.